Your cat isn't acting sick. But something's different. They're not jumping up on the counter like they used to. They sleep a little more. Maybe their appetite's off, or they've stopped grooming as thoroughly as before. And in the back of your mind, you start to wonder, are these just the normal signs of aging, or is something else going on? Cats are excellent at hiding pain. It's part of their survival instinct. And as they get older, their signs of illness become even more subtle. That's what makes senior cat care so tricky. By the time a problem is obvious, it's often advanced. But when you know what to look for, when you understand the changes that truly matter, you can step in early and make a huge difference in both quality and length of life. So let's talk about what really happens when your cat enters their senior years, and what changes should never be ignored. Most cats are considered seniors at around age 10. But it's not like a switch flips overnight. Aging in cats is gradual. One day they're sprinting through the house after a toy mouse, and a few years later, they're choosing the lowest spot on the cat tree instead of the top one. It's not always dramatic. That's why it's easy to miss. Let's start with mobility. One of the earliest and most under-recognized changes in older cats is reduced movement. You might not see them limping. You might not hear any meowing in pain. But if your cat starts avoiding stairs, hesitates before jumping, or takes the long way around to reach a high perch, their joints could be the problem. Arthritis in cats is incredibly common. Studies suggest over 90% of cats over age 12 have some level of joint degeneration. But unlike dogs, cats don't show it the same way. Instead of whining or dragging a leg, they simply modify their behavior. They stop jumping onto the windowsill. They stop climbing. They might even stop using the litter box if it has high sides or isn't easy to reach. If you notice any of those shifts, it's time to rethink your home setup. Offer ramps or steps to favorite perches. Switch to a low-entry litter box. And talk to your vet. There are medications and supplements that can help manage joint pain safely in senior cats. Next, let's talk about appetite and weight. As cats age, their metabolism slows down. But unexplained weight loss is not normal, even in old age. In fact, weight loss is one of the most common early signs of illness in senior cats. You might notice their back looks more bony, or that they're eating the same amount but still losing weight. That can signal hyperthyroidism, diabetes, kidney disease, or cancer, all of which become more common as cats age. If your cat starts eating more but losing weight, that's often a sign of hyperthyroidism. If they're eating less and losing weight, it could point to kidney issues, dental pain, or gastrointestinal disease. Either way, it's not something to wait on. A senior cat who's losing weight needs a vet visit, plain and simple. Speaking of dental health, this is another hidden issue that affects more senior cats than most people realize. Gum disease, tooth resorption, and infections are common after age 10. But because cats don't stop eating completely, the signs get ignored. You might see your cat dropping food from one side of the mouth. You might notice bad breath, drooling, or pawing at the face. Or you might notice nothing at all, until your cat is quietly in pain every time they eat. Routine dental exams and cleanings are crucial. Just like humans, cats develop tartar and plaque that can lead to infection and even tooth loss. And poor dental health doesn't stay in the mouth. It can affect the heart, kidneys, and overall immune function. Now let's shift to hydration and kidney function. If your senior cat starts drinking more water than usual, it's not always a good sign. Increased thirst, along with increased urination, is a common early sign of chronic kidney disease. It can also indicate diabetes or hyperthyroidism. A healthy cat should not be draining their water bowl every day. They should not be soaking through the litter box. If you're scooping clumps that are suddenly twice the size they used to be, or refilling the water multiple times a day, it's time to get a blood panel and urine test. Catching kidney disease early gives you options. There's no cure, but early treatment with diet change, hydration support, and medication can extend life and preserve comfort significantly. Waiting too long, though, means fewer choices and more irreversible damage. Another thing you might notice is a change in your cat's coat or grooming habits. Senior cats often groom less. This can be due to arthritis, because it hurts to twist and reach, or because they're feeling low energy from underlying disease. You might see a duller coat, more mats, or greasy patches. You might notice dandruff or flaky skin. While it may look cosmetic, it's usually a clue that your cat isn't feeling great. Healthy cats groom regularly. When they stop, there's a reason. Sometimes older cats also develop over-grooming behaviors, especially on the belly or legs. This can be caused by pain, anxiety, or neurological issues. If you see bald patches or sores from licking, your cat is trying to soothe something. Get it checked. Let's talk about behavior and personality changes, because this is another major area where signs get missed. A cat that used to be outgoing and affectionate might suddenly seem withdrawn. They might hide more, or a quiet cat might start vocalizing more, especially at night. These changes could be due to pain, vision or hearing loss, or even cognitive dysfunction, sometimes referred to as feline dementia. Yes, cats can develop memory loss, confusion, and behavioral shifts as they age. They might forget where the litter box is. They might wake up and meow at nothing. They may pace, seem disoriented, or sleep all day and become restless at night. Cognitive changes don't always mean the end is near. There are supplements, diet changes, and even medications that can help support brain health in aging cats. But early intervention matters. The longer you wait, the harder it is to bring them back to balance. Litter box issues are another major sign something's wrong. A cat who's always been tidy and consistent doesn't just forget how to use the box. Accidents can point to arthritis, pain, dementia, kidney disease, or even just difficulty reaching a box that's too far or too high to enter. If your cat starts peeing outside the litter box, don't assume it's behavioral. Check their access, look at their mobility, and schedule a vet appointment. Litter box changes are one of the most common early signs of medical issues in older cats. There's also the issue of vision and hearing loss. If your cat starts bumping into things, missing jumps, or reacting less to sound, their senses may be fading. This happens gradually, and many cats adapt well. But you can help by keeping their environment stable. Don't move furniture frequently. Use soft lighting at night. Make sure food, water, and litter boxes are easy to find. Just because your cat is aging doesn't mean they can't live a rich, active, happy life. But they need your help to do it. They won't complain. They won't ask for help. They'll just slow down, and if you don't know what to watch for, you'll miss the early warnings. So what can you do? Schedule annual vet checkups, every 6 months if your cat is over 12. Don't wait for symptoms. Get baseline blood work and compare it each year. Track weight. Watch water intake. Look at the litter box. Pay attention to changes in grooming, energy, and appetite. Keep their environment senior-friendly. Soft bedding, easy access to food and litter, ramps to favorite spots, a warm, quiet space where they can retreat. And above all, don't write off new behaviors as just getting old. Aging isn't a diagnosis, it's a stage, and when it's supported with awareness, your cat can enjoy those later years in comfort and dignity. If this helped you understand what to look for as your cat gets older, subscribe. Because senior cat care isn't just about adding years to their life, it's about making those years feel good, for them and for you.